So when we talk about infectious agents, one of the systems that we see a lot of infections in is the urinary and the genital urinary system, right? And so if we think about this, if we just look at the urinary tract, right, it's really the components that make up the filtering mechanism, the kidneys, the ureters, the bladder, and really the opening of the urinary tract to the environment. And of course, that's the urethra. And each of these things can be infected, right? So you have urethritis, that can be the infection of the opening of the urethra, right? You can have cystitis, which is the infection of the bladder. And you can have nephritis or pyelonephritis, which is the infection of the kidneys, and that's much more serious, right? So if we look at that, you guys are familiar with the anatomy already because you've taken Anatomy and Physiology 1. Genital urinary system for the male, all the parts of the genital urinary system can be infected, including the VODs and the epididymis and the testes, right, and the penis, right, and the prostate, right? So all those things can be infected. And then also with the female, all the different parts of the female's reproductive system can be infected, including the ovaries and the fallopian tubes and the vagina and the cervix, everything that you can think of, right? There are some innate defense mechanisms when we think about how this particular system is protected. You know, of course, the male and the female urogenital systems are different, right? And in some cases, the male system shares tissues for both the reproductive and the urinary system, but they all have some innate defenses, right? So they have mucus secretion, secretory IgA, right? But the opening of the urethra is highly colonized, right? And if we think about that for a minute, with the male, it's further away from the anus than with the female. With the female, the proximal distance to the opening of the anus and the urethra is a risk factor for the development of infections within the bladder, especially, right? And so any type of activity that might jostle or push organisms into the urinary system, like sex, um, is a mechanism by which women can get infected. Now, men do get urinary tract infection. They do get bladder infections also, especially as we get older, because we become a little bit incontinent and we have lots of other problems, right? But the vast majority of the urinary infections that we see are typically in females, just because of the shorter urethra and the proximal distance to the opening of the urethra from the anus itself, right? Now, how does that work? Well, first of all, not all microorganisms are bad, right? And so if we think about them, right, so the outer region of the urethra is highly colonized, right? Now, some of those could get into the urethra, to get in through the urethra into the bladder, and eventually make its way up to the kidneys, and then there could be a big problem, right? But most of those are protective. They do not allow for other infectious agents to become colonized. And so it's important to understand that. But it's also important to understand that movement of the microorganism can occur from essentially a fecal contaminant, right? So most of the time we're going to see that the organisms that are associated with feces are going to be the number one causes of urinary tract infections, right? And E. coli is number one cause. So you need to know that for the exam. If I ask the question, what is the number one etiology for urinary tract infections, it's going to be E. coli. E. coli by far is the number one cause of urinary tract infections, right? But you can see that the organisms can enter through the urethra, go into the bladder, maybe stop there and cause cystitis, but then maybe travel up into the kidneys and then cause a more serious infection, which we call pyelonephritis, right? And so that can be really serious. And we treat them differently because a kidney infection is much more serious than a bladder infection, right? Although if you've ever had one, you think they're both pretty bad, right? It can be pretty serious, pretty painful, right? Yeah, yeah. So I'm not trying to diminish the fact that these are not that a cystitis, that a bladder infection is not serious. It is, but it's not as serious as a kidney infection, because from the kidneys, the infectious agents could get into the bloodstream, and then you're going to have a whole other series of events that are going to be really, really serious, right? Yeah. So if we think about this, urine itself is a really good medium. It is like lunch for the bacteria. And if you don't believe me, urinate in the toilet and don't flush it down. Let it sit there and continue to urinate in the toilet. Right now, if you do other business, then flush it down. But if you're just urinating, just let it, and see how long it takes for that urine to become foul and for that urine to develop a pseudo skin on the surface of the actual toilet. It won't take very long, right? And sometimes you can visit public places, and if you yeah, so well, sometimes you can visit public places, and you might go in there prior to them have cleaning it, and maybe, like, for instance, if you, I don't know, if you're at a at an outdoor concert or a sporting event, and let's say you get there early and you have to go to the bathroom, and you go to the bathroom and they clean the toilets a certain time, but maybe somebody, before they left for the evening, after everything was over, they urinated in a toilet or in a urinal, um, and it hadn't been cleaned, because the maybe that event, that place hasn't been used in a couple of days. You come back, and boy, that stuff smells horrible, right? And so you can see that urine is a beautiful medium, right? And if you don't want to do it in the toilet, James, you could take a plastic cup and urinate in the cup, and just spit in the cup, just spit in the cup, and see how long it takes for that urine to become foul, because it will become foul very, very quickly. Okay, because urine has got a lot of great stuff in it that bacteria like, including sugars and amino acids and a bunch of other good stuff, right? Um, and so it is important to understand that. So if we look at cystitis, bladder infection, right? It's usually pain around the lower abdominal area, the pubic area, right? Frequent urges to urinate, even when your bladder is empty. It's just an infectious agent who's there, who's causing those urges, right? Your body wants some relief from that sensation, that pain, and so you want to go and urinate. But a lot of times you go there and nothing happens. Or if you do urinate, you have what we call dysuria, and dysuria just simply means that you have a very abnormal urination process. It's painful, right? You can have cloudy urine. Your urine should always be lightly yellow in color. And if you're flushing fluids, if you're drinking a lot of water, it's going to be almost like it just has a tinge of yellow to it, right? That's normal. The more concentrated the urine is, the more dehydrated you are. So you want to go ahead and take in some liquids if your urine is very concentrated. Usually, um, for individuals, that's going to be early morning when you first wake up and you go to urinate and you notice that your urine is strong in odor and it's very yellow. Right? That doesn't necessarily mean there's something bad happening. That just means that you're dehydrated and you need to drink some water. Right? So think about, all night long you've been breathing, you've been giving off lots of water, and so you're a little bit dehydrated. Drink some water, you'll be fine. Right? Sometimes urine has a pinkish orangish tinge to it, and that means that there's blood in it. We say that that's hematuria, right? You got blood in the urine, and you should never have blood in the urine, right? If there's blood in the urine, that is giving you a clue that there's some type of pathology occurring, and that might be pathology associated, that is genetic. It might be something that's associated with trauma, or it might be something that's associated with a urinary tract infection, and you'll need to further work it up. You should never see blood in the urine. If you are wiping and you notice a little bit of blood in the wipe, then you should really get it checked out, because that needs to be looked into further, right? There might be something going on. You might be in the early stages, the prodromal stages of urinary tract infection. And if you move quickly enough, then you're going to be able to stop it in its tracks, and not really have a lot of further complications, right? With urinary tract systems, especially with kidney infections, although you can have fever with cystitis also, but with kidney infections, much more severe. And you can have fever, you will have fever, and you will have nausea and a bunch of other back pain, and a bunch of other problems, right? And so these are things to recognize, right? And the other thing to recognize is with the elderly, right? If you are a caregiver and you are working with an elderly patient, and all the time you've been working with this elderly patient, whether it be male or female, well, actually, it'd be a little bit different. But if you notice a change in the way that they're acting, then right away you should be thinking maybe they've got a urinary tract infection. And almost every respite or um, you know caregiving facility is going to have urine dipstick test that you can run, and so you'll collect a little bit of urine and look. Just stick that dipstick into the urine and see what you can see. Right. And usually, the indications with the dipstick that there's a urinary tract infection is they're going to be red blood cells. They're going to be maybe white blood cells, leukocytes. Um, they're going to be protein and or urobilinogen or bilirubin. You're going to see those things, right? And if you see those things, then you should go ahead and make contact with the physician to try to get your patient some relief. Cranberries have been kind of the subject of a lot of kind of discourse about whether or not they're protective or not. Some people say they are. Some people say they are not. The the literature out there is kind of split down the middle. So I say, if nobody's sure, then it can't hurt, right? So what I would say is cranberry juice, not cranberry drink, but cranberry juice is a pretty healthy uh, is a pretty healthy preventative mechanism, right? It's got some proanthocyanidins that do not allow for the attachment. We know that these molecules do not allow for the attachment of the microorganisms to the surfaces of the urinary tract. So if we know that, but the literature is all over the place and we're not sure if it works or not, maybe you incorporate a little bit of um, cranberry juice to your diet, right? Maybe drink it in the morning. And I'm not talking cranberry drink, I'm talking cranberry juice, right? Because you want the protective mechanisms of those molecules, right? Um, Again, I'm not a doctor, I'm not giving you medical advice, but I do drink cranberry juice, right? Frequently. And so it's just one of those mechanisms that we can use to help us with managing our body, right? To help our body be a better source for us, a better efficient machine, if you will, for us, right? So we talked a lot about these things, right? I do want to tell you that the lower respiratory tract infections, infections of the urethra and the bladder, cystitis and urethritis, um, those are easily treatable, and although they're discomforting, we can get rid of this pretty quick. Pyelonephritis is a whole different thing, right? It's really serious. It can lead to all kinds of problems, not just the physical ones where you have back pain and you're hunched over because you are in pain, but we need to treat those pretty intensely, right? Um, and not just leave it, right? Because if we leave it, then it become much more serious, and then people can really have problems with it. There is a whole science to just the treatment of urinary tract infection, and so that's the most important antibiotics that are used to treat urinary tract infections here. You are not responsible for knowing which antibiotics should be used in a urinary tract. This will not be on the exam. But I just think as a nursing or a person going into healthcare, I just think you need to understand that everything is complicated, right? And with microbiology, to me, it's the most important science ever to a healthcare worker, because what you understand very quickly is it is a qualitative science, right? It is like nursing. It is like being a dental hygienist. It is like being a surgical technologist. It's like anything in medicine where you have to look at all the data that's presented to you, and then you have to make a judgment, right? There are no real true numbers that are going to help you sometimes, right? You're going to have to make a judgment about what is important, right? Go into a room, you have a problem who's orthostatic. What do you do, right? Well, you call a physician, but what do you do for that patient right then and there to save their life? What do you do, right? Well, in some cases, you're going to have to react to those things, and in some cases, you're not going to get it right. And you have to understand that that is part of being a nurse. It's a practice. You will not be a very good nurse the first 2 years you are a nurse, but you're going to get better. And by the time you get to your third, fourth, or fifth year, you're going to be an extremely fine nurse or extremely fine dental hygienist or an extremely fine whatever, because it's a practice, right? And you get better with the more practice that you get at that job, right? And so I want you to not be afraid to make some judgments, right? You will learn more about this when you get into nursing school. And I want you to always remember that being a nurse and working in the medical fields and working with patients and saving patients' lives is not an individual job. It is a job of a cohort of people, right? Because everybody has a little bit of knowledge that can help you. So if you don't know, you need to ask, right? And so that will help you become a better practitioner, a better nurse. Okay. Hopefully you will understand a lot more about that as you get into your program, right? So again, E. coli is the #1 cause, but you can see that Staphylococcus saprophyticus and Proteus mirabilis are other causes. I'm going to show you in a minute a pie chart that shows the infectious agents that are mostly responsible for those urinary tract infections that are not complicated and those that are complicated, right? But the symptomology is here, right? You will not need to know the exact symptomology, but these are things we've already talked about, right? And I just want you to be aware that for everything, right, as you become a healthcare practitioner, you're going to have to know these things, right? They're going to have to be in your mind so that when you are working with a patient, you can put things together and then report it to the charge nurse, the head nurse, the the ward, whatever, or the attending, right? You're gonna have to report it so that you can help your patient, and that's really an important thing. Okay. If we look at this pie chart, right? So uncomplicated urinary tract infections, you can see that the risk factors are being female because of the proximal distance from the opening urethra to the anus and because of the shorter urethra. You need to know that, right? Older age and younger age, right? Um, so with the younger age, especially with the female, if you're not real careful, um, there could be a mixing of feces with the urethra and they could develop urinary tract infections. And so there are these things that can happen, right? But for the most part, you can see the risk factors are being female, being older, or being younger. And if you look at the organisms, you can see that urinary pathogenic Escherichia coli, E. coli, makes up 75% of all the urinary tract infections that are not complicated. They're uncomplicated. And you should know that. The #1 cause of urinary tract infections is E. coli, right? But you see Klebsiella, Staphylococcus saprophyticus, Enterococcus, Group B Streptococcus, Proteus mirabilis, Pseudomonas aeruginosus, Staph aureus, and Candida. All these organisms we talked about, they are all involved here, right? Where if you look at complicated urinary tract infections, these are ones that there's a lot going on. The patient is a lot sicker, and they might have things like indwelling Foleys or catheters in them. They may be immunosuppressed. They may have urinary tract abnormalities. They might have had a lot of antibiotic exposure, right? And so the organisms that are associated with their GI tract are all organisms that are drug resistant. And so when you get infections, these, you can see that E. coli makes up the still the primary cause, but now other organisms are playing a role. And if you look at these are the organisms that have developed drug resistance, antibiotic resistance, antifungal resistance over a period of time, right? So we're looking at Klebsiella pneumonia, but the big player here is Enterococcus. Look at the jump of Enterococcus, right? And so also Candida, right? So you can see that there's a difference when you have these problems. Um, and so we need to be aware of that. Okay. Any questions? All right. So here's the publication. If you're interested, it was in Nature Reviews under microbiology. And if you're interested in that article, you can look it up and read it. Right. I want to talk about an environmental microorganism that is associated with the urinary tract of wild animals mostly, right? It's a zoonosis, and we do see leptospiria or leptospirosis infections in adults and in children, but mainly what we're beginning to see them is more prominently in dogs. Um, and so there is a leptospiria vaccine that you can take, but we have a problem here, right? And so leptospiria is a spirochete, right? I'm sorry, it's a spiral shaped bacterium, and it usually gets into us because we come in contact um, with a contaminated environment, and it's usually after big rainstorms, right? So, but it can be other things, right? So here you see kiddos in the rain, in this creek or whatever it is, and so you can see it's really pretty dirty. Again, you should never get into a body of water that is a river, a pond, a stream, something like that. After it's rained, you should let the water clear out and then go ahead and get in. Swimming pools are different, right? But you can see that leptospiria can cause infections systemically, on the skin, in the eyes, right? And a lot of them are going to be associated with wild animals. So here I'm looking at rats, mostly because when I was in college, going through college as an undergrad, I had 3 jobs to pay my way through, right? And so one of those jobs was that I was overnight stocker at a grocery store. And I don't care what grocery store you work at, because of the food, you're going to have problems, right? And so sometimes you'll see these little critters running around, and you know that if you catch them, you caught one of them, but there's a bunch of others you just don't know about. And so, like, I don't know if you've ever um, opened up a can of something uh, and drank the drink out of a can, like, I don't know, soda or something, and had this real bitter taste to it. Well, unfortunately, ladies and gentlemen, that's urine from some animal that you have now tasted, and potentially you become exposed to leptospiria, and this would become a problem. Right? I did that once and never again. So I do not drink out of any can, and if I do, I wipe down the lid really well before I drink. But usually I will, if I'm drinking out of a can, which I don't do usually, but I will pour it into a glass and drink it out of a glass and not out of a can. That's just my way of mitigating risk, right? I'm not germophobic, but I don't really want to have that bitter taste in my mouth ever again. It was one of the most terrible sensations I ever had in my life. Okay. Any questions of leptospiria? So here's the organism Leptospiria interrogans. It's contaminated soil or water or some fomite, right? The surveillance factors are that it has adhesions and invasive invasion properties, right? And it can cause all types of infections. It's treatable. You just gotta have some type of idea of what's going on. For men, I want to mention prostatitis, the infection of the prostate. And men typically get this at an early age, um, usually in their teens or their early 20s. And sometimes they just think that they've been working out too hard and it's just painful in that part of the body, right? Because sometimes you may not have any fever, sometimes you might, right? But the clues are that it should never be painful when you're having sex or when you're urinating. that's an indication that there's something wrong, right? And so you should get it checked out, because if you don't, one of the common themes that we're going to see today is that these infectious agents who cause infections in the urogenital area not only can cause acute infections, but might cause damage to this part of the body that allows for people to become um, infertile, right? And so that's when my generation had the largest prevalence of individuals who were not able to have children, right? The idea of getting checked up and doing better health care has really changed since I was, in my early 20s. But a lot of times people would go with this kind of just real light pain in their pubic area or in their abdominal area, and all the time they were having problem with prostatitis or um, sapulonitis, which is the infection of the fallopian tubes, and that led to infertility. So my generation had the highest prevalence of infertility. Right, it's gotten a lot better now because education has gotten a lot better, and so that's an important thing to think about. So there are lots of infectious agents that can cause this, right? And a lot of times you pick it up during sex, and you get treated for something else, right? You get treated for a wound, I don't know, whatever. But the antibiotics that you get treated for clear up the infection for the prostate, and then you just don't have any more symptoms, and you go on with your life, but you never really knew that you had an infection of the prostate until later on when you're trying to have children, and you find out that you're just not able to do that very often, right? It's just not working. Okay. Any questions about prostatitis? Okay. Can I get a hello from somebody so I know you're still there? Thank you. Okay. Let's go on to talk about vaginitis and vaginosis, right? So vaginitis is truly the inflammation of the vagina, right? And you could say ballantitis if you want to, infection of the penis if you want to, right? Vaginosis is different. Vaginosis is the overgrowth of microorganisms in the vagina. Okay, so with vaginitis, vaginosis, especially with vaginitis, you're going to have inflammation of the vagina. There can be vaginal itching to some degree, burning, and sometimes a discharge associated with it. And then you can have other symptoms, right? Depending on the etiological agent, right? Whatever it might be. Okay. Hi, Lakeisha. Thank you. So, I so why are you really talking about this and not really addressing the male? Unfortunately, with the male, there's a lot of times if the male have problems with yeast or things like that, they're not going to truly appreciate any symptomology, right? And with other problems also, there's not going to be a lot of symptoms associated with them. Women also, but the women have a much larger surface area of the vagina, and so therefore the organisms can grow and eventually get to become problematic. And a lot of times, women will not seek medical advice. They will just think, okay, I have a yeast infection and I'm going to go and buy, something that'll clear it up at HEB or whatever, and then they treat themselves. Well, if you're using an antifungal to treat vaginitis and it's not a fungus, it's not a yeast, you're just going to exacerbate the problem. You're going to make it worse, right? People don't understand that. Yes, yeast infections are real common, and most of the time when you truly see that, no, 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 not normally, Nelda. So a lot of times, because the opening to the penis itself is much smaller, the men do not have the egress of the infectious agents like we see in the female, right? Especially during sex. And so there's not that egress, right? And so we don't see as much symptomology in males. However, I will tell you this, Nelda, and you probably know this from hemodialysis, is that men don't handle these types of things very well, right? They're not used to the pain associated with a urinary tract or an infection of the penis, and it's like they're going to die. They're in that much pain. Uh, yeah, yeah. So with women, Women are much more steady. They're much more, you can tell they're in pain, but they don't like overly respond to the pain itself. They get in the car, they drive themselves to the physician, they get checked out. Men, you have to like almost, and I'm kidding here, but being dramatic, but it's kind of funny because you almost have to call an ambulance to take them there, right? Because if they move, it hurts, and they don't want to move, right? So yeah, it's an amazing thing to see that difference in the gender uh, um, of how people respond to these things, right? I do want to tell you that the number one cause of yeast infections, of course, is Candida albicans, and we know this. We talked about this. I'm not going to spend a huge amount of time on Candida albicans. Oh, okay. Oh, I'm not going to argue that, Lakeisha. I'm just not going to argue that, right? But Candida albicans, again, not only can cause thrush and anal thrush, but also vaginitis, a yeast infection, right? Um, but we need to understand that the organism itself, Candida albicans, is normal inhabitants of the body. And so women, you should know this for the exam, women are more likely to contract um, vaginitis um, after a bout or a regimen of antibiotics, because what has happened is the antibiotics have killed off all the organisms that are susceptible to the antibiotic. And that includes a lot of the bacteria that are normal inhabitants of the vagina. Well, you think about the vagina, it's got the perfect amount of moisture, the perfect amount of nutrients, and it's the perfect temperature for these organisms, right? And so the yeast are in there, and there's nothing stopping them now, right? The bacteria that were keeping them in check have now been destroyed. And so the yeast have all this room to come back to, and they can cause problems, right? Yeast infection. Now, those can be treated pretty easily, right? But sometimes women are asymptomatic, and sometimes they come in contact with a male that is asymptomatic, right? But usually you can smell the presence of yeast on a person, right? It smells eerily sweet when you smell it, right? And maybe at that point you should kind of just watch a movie instead of doing whatever you're gonna do. Anelda, that's not just in that area. That can be, some of yeah. So that can also be with our heavier individuals. The yeast can actually be on the folds of the skin, right? And so you can have yeast infections that are underneath the breast or in the armpits or in the ankle area around the curvatures of the legs where they meet the pubic area. You can have all that kind of problem. Now, don't get me wrong. It can smell other things too, right? But it smells eerily sweet, yeah, to some people. Okay. Gardnerella. So Gardnerella is um, a perceived problem, and I say that because a lot of people come down with this organism, um, but it's self-limiting to a lot of people, right? And it's called vaginosis rather than vaginitis because it doesn't really cause inflammation. It's just the overgrowth of the organism, right? Which leads to a very kind of fishy odor, especially after sex, right? Especially moving things around within that part of the body. There can be this real fishy odor. Now, if people appreciate a fishy odor coming from that part or that region of the body, they're going to get it checked out, right? And so um, it can be treated very easily with an antibiotic, right? And men, unfortunately, don't have a lot of symptomology. They're mostly the carrier, right? Because there's not a lot of movement into the penis by this organism. It's mostly on the surface of the penis, right? Itching, though, is pretty common, right? And so if we think about this for just a minute, then there are three different organisms that can cause vaginosis, right? Mobiloncus, Mycoplasma hominis, and Gardnerella vaginalis. For the scope of the exam, if I ask you what is the etiology of BV, bacterial vaginosis, it's going to be Gardnerella. Okay, good. And so a lot of times when women sometimes appreciate the smell. They think it's a yeast infection, and they go and get an antifungal at the grocery store. They treat them with an applicator, right? Um, but then the problem just gets worse, right? Because this is a bacterium and it's not a fungus, and the antifungal is not going to do anything to it, right? So if we think about this, this makes up a lot of the problems that we see in young adults, especially women, right? And as a matter of fact, I want to make mention of this because I want you all to be aware, especially if you are a parent of young ladies who are going to enter their teens, is that women, young ladies, can acquire BV without having sex, right? There can be lots of other mechanisms by which they pick this up, right? I had a student who was in the green belt and swimming in the green belt, and her daughter was 13. They both developed this really weird symptom, and she called me on the phone and said, "What do you think?" I said, "You need to go and see a physician. It sounds to me like you have a case of BV, but you won't know for sure until you go get it checked out." And sure enough, she called me back later and said, "You were right." And so they gave us antibiotics, and it's going to take care of the problem. But so you just have to know that if you take your young 14-year-old daughter to the physician and she gets diagnosed with BV, you do not you should not assume that she is having sex, right? You need to be open to your all your kids about sex, and teach them what you want them to know, because if you don't inform them about sex, it is one of the most um, it is one of the most it is one of the strongest um, what's the word I want to use? It's one of the strongest um, characteristics. I can't find a better word, but characteristics that humans have, right? It's uh, because they come in contact with fomites or other things that might they might have it that way. So there's been cases of young girls sharing swimsuits or using the same towel, and in that case, they can pick this up that way, right? Or in a creek like my student was in, right? But if we think about this, then sex is the only thing that is greater for us as an instinct. Oh, that's a good word, instinct. The only thing that's a better instinct for us is survival, right? So we will go into survival mode really quickly. The second most important instinct that we have is being curious about sex, right? And so if you don't if you don't talk to your kiddos about sex, and they're just going to learn it from somebody else, like their friends, and their friends may have learned it from another friend, and now they don't have the best information, right? Um, kids, young kids, are going to have sex. I'm going to show you a chart in a minute that will show you when a lot of kids start and what percentages of children have sex by the time, by the time they're a certain age group, right? And so it's really interesting to understand that, right? And so again, we need to care for our kiddos, but we need to empower them so that they make the best decisions in case they decide they want to have sex, that they'll make good decisions. Okay, so if we think about that, then again, um, douching should not be done. The other thing is having multiple sex partners is a problem, not only for BV but for other sexually transmitted infections. As a matter of fact, the more sex partners you have, the likelihood that the probability that you're going to contract a sexually transmitted infection goes way up, including HIV, right? But the thing that I want to really stress is that BV can be acquired by women and men, really, if you think about that, but mostly women, even though they have never had sexual intercourse. And so that is an important thing to understand, because if you take your kiddo and they say, well, you've got a case of bacterial vaginosis, if you move into the assumption that they're having sex and you challenge them on that, you're just going to drive a wedge between you and them on, unless you already have this really great relationship where they trust you. Now, trust is an interesting word, right? Because you can trust your parents that they're going to take care of you forever, but you might not trust your parents with important details of your life, right? And important details to a young kid's life is very different than important details to um, an adult's life, right? And really, that has changed drastically because of social media. And now with the bullying that goes on with social media, you can have a perfectly happy child one week and then they withdraw because somebody has really done some mean things to them on social media. So, there's all these levels of trust with different things. And, I don't have kids, but I have a couple of nieces and nephews that come over and visit with me. And sometimes they don't trust their parents to tell them what's going on in their life, but they trust me and they'll tell me, and then I try to give them the best advice as possible, right? Um, and then they make me promise that I won't tell their uh, their parents, right? So you have to understand that there are going to be people that these kiddos are going to trust, and you want to be able to give them the best advice possible. And I try my best. And if I don't know, I will tell them, look, I don't know you need to really talk to your parents about this, because, that is not my job to give some types of advice to kiddos, right? And which might even go against the parents' wishes. And so you just got to be real careful, right? So vaginal odor, itching, irritation, right, can be particularly noticed during intercourse or menensis, right? You can have that unpleasant fishy odor, right? And so you need to get checked out. One of the things that this can lead to, of course, is the complete destruction of the ovaries, right? And so you can see that the ovaries can be destroyed, which then can lead to infertility. And so we just need to understand. The other thing is, of course, the other infectious agents that are more serious and could cause chronic infections, and those would be things like, of course, HIV, which then can lead to AIDS. Diagnostically, to identify BV is real easy, right? Some people will just take a little bit of a vaginal or a cervical smear and take a little bit and put it into potassium hydroxide, and it releases a fishy odor, and they call that BV at that point. I can't do that. To me, that's just not good enough, right? So what I consider good enough is just looking under a microscope, because if you look under a microscope, the evidence will be very, very easy to see, and that evidence for BV is a clue cell, right? And so if you look at the differences, right? So here is kind of an artist's illustration of clue cells. You can see that they are highly attached to by these small gram positive rods. Here's normal, because you're going to have bacteria there, right? It's normal. Here's a gram stain looking at a clue cell, right? Look at all the colonization of the organism on it. Here, of course, you'll see normal vaginal epithelial cells. And you have some, but you're not seeing any fraying or complete colonization. Where if you look under the microscope under a wet mount, you can see that this epithelial cell is just completely covered with these bacteria, and they're frayed. It's beat up, right? And so here you can see a normal one, right? And so it really gives us a great indication that there can be some problems, and which is easily treatable, right? And so you treat it with an antibiotic, right? And so it's not a problem. You can use metronidazole, which is kind of one of those antibiotics that can be used for bacteria and also can be used for certain protozoans, or things like clindamycin or things like that can be used, right? You do not need to know treatments for this organism. because every physician is going to have a different experience, and so different antibiotics will be used. So I'm not going to expect that you're going to know a specific antibiotic for BV. Okay. If we look into the cervix, again, this is kind of an artist's illustration of what's going on, right? You can see that you can have these kind of creamy developments or colonies of the, if you're looking at the cervix, right? And that's going to be indicative of our friend Candida. You can have this overgrowth and the fishy discharge and a yellowing of the mucopurulent discharge itself, and that's with BV. Or you can have, a complete covering. Plus, you also have the cervix, which is kind of looks like it has these little bitty ulcers on it, right? That's called strawberry ulcer. You need to know that. Strawberry ulcer is indicative of another organism we're about to talk about, which is Trichomonas, right? And so strawberry cervix is a really good indication of having an infection by Trichomonas. Okay, so we've talked about the infectious agents that can cause problems that can be related to sex, but not necessarily, right? We're about to talk about organisms that are truly what we consider to be sexually transmitted. And so we're moving to that particular discussion with me telling you that I like to group sexually transmitted infections into 3 groups, and you should know this. They are discharge diseases, ulcer diseases, or wart diseases, right? And you can put infection instead of diseases if you want, right? So if you think about that, right, infection is probably a better term, but a lot of people call it diseases. So I kind of wanted to stay at the same level, right? I did I did um, I did make this particular presentation for a high school. I was asked to be the expert for sexually transmitted infections for a high school, and then so when I got there, when I got to the high school, there were 4 people on the stage and a bunch of kids that had come to this particular presentation. There was the school nurse, there was the principal, and there was a parent. I think the parent was maybe with the PTA. I don't know for sure. And then it was going to be me. Right now, when I came into the building, I had to go through all this, uh, almost like fingerprinting, right? Uh, and then I got a little badge, and I went in, and the principal caught me in the hallway, and he said, "Do you have anything you want to show? I have a presentation." And I showed it to him. He said, "You can't present this," right? So I wasn't allowed to show this to anybody. He said, "You can give it to the nurse and she can use it the way she thinks is best," right? But evidently, some parents found out that they were going to have a microbiologist at this meeting, at this whatever it was, and they objected to the fact that I was going to be there because they didn't want me to give information that was going to allow their students to, um, as they said, it become more promiscuous. So they thought that whatever I said was going to make them more promiscuous. I hope that that's not what they got from this. Yeah. So anyway, I sat there, and the principal said to me, if a question is asked to you, you need to look at me, and I will tell you whether or not you can answer that. So on several occasions, I looked at them, and the parent, the mother, got up and answered the question, and they didn't let me answer, right? So anyway, if you want to, I am okay with you making a copy of this presentation and having it forever. And then maybe when your kids get old enough, you can show them selected parts of it so that you can educate them, so that they know if you want to, right? Um, but um, but it's a really, to me, it's a really good presentation, and it really presents all the information necessary to understand sexually transmitted infections. Okay. You are welcome to have it. As a matter of fact, I make all my stuff available on the public domain, as you might have seen. Um, yeah, yeah, they do. Yeah, that's true. So this is a little more technical than those books, but I make all my stuff available on the public domain. So I've had people from India call me and say, "Can I use your stuff?" I'm like, "Yeah, it's in the public domain. That you don't even have. It's Creative Commons. You don't even have to ask me." But they always call me and ask me if they can use my stuff, right? But I it's open to anybody who wants it. Okay. Now, I will tell you, I'm not a physician. I'm not giving you medical advice because that's not my. That is not my. That is not. I am not that kind of an expert. Okay. All right. Let's talk about Trichomonas vaginalis. Right. It's asymptomatic in about 50% of all people who have infections of this. Right. And some people experience long-term negative consequences or negative outcomes because of the infections that are associated with trichomoniasis or trichomonas. Right. It is an anaerobe, right? And so it's easily treated, right? Um, it's easily treated with an antibiotic, right? Um, and so the World Health Organization has estimated that there are about 180 million cases, uh, incidents on an annual basis, right? And in North America, it's about 5 to 8 million. So North America is United States and Canada. Well, I'm going to tell you, um, United States folks have a lot more sex than Canadians, right? So let's just take the lower end of that, right? The 5 million, and cut that in half. So 5 million, half of those 2.5 million individuals who've acquired trichomonas are asymptomatic, right? And so that can be a problem, right? The presentation of the infection is very different, right? It's got kind of a frothy, yellowish discharge, and that discharge itself, it's frothy because of the anaerobic mechanism of it, right? It can have kind of a greenish or yellowish kind of discharge, and that's because of the pus that's associated. We call that pyretic, right? And so you can have this discharge associated with it also, right? The only way to really acquire this is through sex. Now, there have been cases where some people have acquired it through fomites, but those are really rare, right? So I'm going to be the first one to tell you that you cannot pick up trichomonas from a toilet seat, right? A lot of people say that. As a matter of fact, when I was an undergrad, and I had a lot of really close friends who were women, and we would go to concerts or whatever, I would be kind of the lookout for them going to the bathroom, but they would always tell me that they never sat on the toilet, that they always kind of squatted over it and then, urinated over the toilet itself, right? Because they didn't want to come in contact with the surface of the toilet, right? Um, a lot of time, men do not have any symptoms at all, right? And so, um, therefore, they can be the carrier. And any time that they have sex, they could potentially be transmitting the trichomoniasis or trichomonas to their partner, right? And so, if one of the people have symptoms and go and get checked out, and they've been diagnosed with a sexually transmitted infection, then both of the partners need to be treated. And really, not only that, but any additional partners that perhaps people don't know about, they all need to be treated, because if not, you're just going to have this reinfection process over and over again, right? Where one person gets treated, they get better, but they have sex with that person, and that person has trichomoniasis, and it goes back and forth, and potentially it could be problematic. Okay, so again, it's easy to see, if there is a if the physician looks in to the vagina and sees strawberry cervix, they can, to confirm it, they can take a little bit of a sample and give it to somebody like me. We can do a quick wet mount or whatever, and we can stain them also, but it just takes longer. So we can do a wet mount, and if you know what you're looking for, they're easy to see, right? They're not a problem to diagnose. They're really easy. But this strawberry cervix to me is enough of a clue that there's that problem that immediately we should start to treat with things like Flagyl or some other antimicrobial agent that will get rid of. This is a protozoan, right? So um, we should be able to treat with that, right? So symptoms appear between 5 and 28 days. It has a variable incubation period, right? And so with females, there can be itching or burning of the vagina or the vulva, right? The painful and frequent urination. It can be heavy or unpleasant swelling, greenish to yellowish discharge. With men, probably nothing, right? But you could have the inflammation of the head of the penis, which could actually show up, and that would be a symptom of maybe getting checked out, right? And I can guarantee you, most men, if there's anything wrong with their junk, they're going to check it out pretty quick, right? Because they really care about that part of their body. Okay. Treatment is, yeah, treatment is really with things like metronidazole, but there are other effective antimicrobial agents that can uh, that can treat this accurately and effectively, right? There are um, there are some links to infections of Trichomonas and HIV. So if you have had a case of Trichomonas, then the likelihood that you might have contracted HIV goes up. And then also um, with 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 women who are pregnant and have acquired Trichomonas, a lot of times their babies are delivered early, so they have a low birth weight or premature infant, and that can be problematic in some places, right? Not necessarily in the United States, but in other places in the world, that can be a huge problem. Okay, here's an epidemiological map showing that other cases of trichomonas, and so you can see that in the Americas, there's about 27.4 million annual cases, right? And so that's all the Americas, right? But if you look at just Australia, there's 45 million. And so why is that, right? So I don't have an answer for that, but I think it's just really interesting that that we have those kinds of things associated with trichomonas, right? So um, condoms are almost, I'm not going to say 100, 99% effective at not allowing the transmission, right? And then also I talked about, because there have been a couple of papers written about young ladies who were sharing swimsuits or towels, and then it had trichomonas. At least that's what we think, right? And so, I just think that probably you need to use your own towel, right? And there's no reason to share swimsuits. I mean, I don't think. Or if you're going to share swimsuits, maybe wash them, and and then you can share swimsuits if you want after that. Okay. Any questions about trichomonas? There is a group of researchers in San Antonio, and I don't remember the name of the lead person there. You could look it up if you're interested in. But the research group in San Antonio says that worldwide that this is the most prevalent sexually transmitted infection that there is. Now, I don't have that experience that they do, so I can't comment to that. But what I will say is that in the United States, it's not trichomonas, it's chlamydia, right? And so that's from my experience, right? And so that's what I'm going to say about that. I'm not saying that they're wrong. I'm just saying I don't really have the experience to talk about that. Okay, questions. All right, let's talk about gonorrhea, Neisseria gonorrhea, right? So usually an infection of the superficial mucosa, and that's the cervix, the urethra, the rectum, the pharynx, and really the eyes also, but really it's the eyes of kiddos, and I'll explain why in a minute, right? And so it's very easy to diagnose, right? So if you do a gram stain, what you're going to find is you're going to find a lot of neutrophils, and you're going to see gram-negative diplococci that are um, associated with those neutrophils. Now you're seeing a lot of other organisms in here, but if you look really closely, you can see the gram-negative diplococci all around the neutrophils themselves, right? And so all the other things are just things that if people don't know what they're looking for, they just don't know you know, how to diagnose these things very quickly, right? You have to have kind of a trained eye to be able to look at this. But the gram-negative diplococci are in a lot of different places, right? You can see they're here, they're here, they're they're here, right? So they're just in a lot of different places, right? And so that's a quick indication, right? It's one of those things that really shows up in males, right? So you have this discharge coming out of the head of the penis, and that discharge has got pus in it, right? And so we'll usually clean this up, and then we have this small applicator that looks kind of has like a little brush at the end, and we stick that into the penis, and we pull out a little sample that way, and then that's what we look at, right? Because there could be so much contamination uh, from the skin itself from looking at this that it's just going to complicate things. But here you can see are the neutrophils and the beautiful This is one of the most beautiful slides that I've ever seen of this particular organism. You can see the gram-negative diplococci, which is indicative. If you have a purulent discharge like what you're seeing on the upper image, and a gram stain that shows you neutrophils and gram-negative diplococci, I'm 99.9% sure that this person has gonorrhea. Right now, it can go into the epididymis and other parts and cause scarring of the tissues, which then can lead to infertility, right? So I told you that that was going to be one of those overall themes. And so on the exam, if you see a question about long-term negative outcomes or chronic problems associated with sexually transmitted infections, can be A through whatever, and one of them says infertility, that's going to be the answer, right? I might even say after treatment there can be long-term negative outcomes or chronic problems, and that's going to be infertility, right? And that can lead to, again, also problems with the infection, sabinitis of the fallopian tubes, which then causes scarring of the fallopian tubes in females, which then does not allow for pregnancy to take place. And so infertility, again, can be problematic, and also pelvic inflammatory disease also. Here you can see is a child who was born from a mama who had gonorrhea, and the, the organism got transmitted or got transferred to the eye of the left eye of this particular individual. We can treat for that, but if it's too far gone, there might be some long-term negative outcomes to the vision in that left eye, right? A lot of times with infants who are delivered, we will treat them with a kind of an ointment of an antibiotic, and there's a lot of different ones that can be used, and in some places they use silver nitrate. That is the infection of fallopian tubes, Mr. James. Okay, yeah, okay, questions. All right, let's move on to talk about another discharge infection, chlamydia. Chlamydia, to me, is the #1 sexually transmitted infectious agent in the United States. Right? We see a lot of it, and a lot of times it it's it's a mimicker. It mimics a whole bunch of different things, right? Um, and so I don't know. I think I told you this before. When I was at Texas State as an undergrad, I went to the infirmary to get some treatment for allergies, and they wanted to test me for chlamydia. So I'm just here for allergies. Yeah. So anyway, it's very prevalent on college campuses, and so it's important to understand that it can lead to all kinds of different things. Symptoms in males, inflammation of the urethra, which is painful. Yeah. It mimics gonorrhea, right? It mimics a lot of things, right? Untreated can lead to epididymitis or prostatitis and scarring, right? With females, you can have cervicitis, you can have discharge, you can have infection of the fallopian tubes, which then can lead to pelvic inflammatory disease, right? Clinical presentations, we just talked about it a little bit, but here you can see there's a whole workup of different ways that the infectious agent is presented. And there are other chlamydia that can cause problems, right? And so I do want to make mention that not all of them are going to be chlamydia trachomatis, which is the #1 etiology for sexually transmitted infections. You can have all kinds of different infections from different types of chlamydia, right? So you can see that chlamydia trachomatis is probably the most prevalent of all the organisms, but there are other infectious agents. One of my favorite ones is chlamydia psittaci, which is associated with birds. And we had an outbreak of chlamydia psittaci 15 years ago in a little town. It's not little anymore. A town right around Austin, where they had parakeets in their um, in their homeroom on elementary school, and they got 2 boys to clean out the to clean out the bird cage. And you never want to put 2 little boys to clean out a bird cage, because they're just going to flick things all over the place. And so evidently they created a lot of dust, and the 2 little boys came down with a lung infection um, associated with chlamydia psittaci for a little while there. And I don't know if this is still true for those of you parents out there, that in Austin they were not allowed to have like homeroom pets because of the potential for infection. And I don't know if that's still true anymore. Um, but it can be a problem, and so people just need to be aware all the problems that can occur. Okay. So it's an obligate intracellular parasite. Okay, yeah, I kind of figured that would be true, right? And so we've already talked about the fact that the bacterium can cause prostatitis and epididymitis in men, cervicitis, sepelinitis, all types of infections in females, and lead to infertility. Epidemiologically, if we look at this, I have a couple of different graphs that I wanted to make a mention of. So you can see the darker the color in the upper. This is from 2018, so it's pretty recent. I mean, I wasn't able to find a more current map, but this is pretty good, and it really kind of does tell the story of where chlamydia is. So you can see there's a lot of chlamydia infections going on, kind of in the south, right? No matter how you look at it, with the exception of Alaska, right? So Alaska was very surprising to me because it's not heavily populated. But in Alaska, there are some interesting things going on there. They have a app in Alaska that's kind of like Tinder, but it's a lot more um, out there, if you will. And so people kind of have um, what do you call this? Pseudonyms, and they present themselves to people, and then they meet um, for casual sex. And so there's a huge amount of sexually transmitted infection that's going on in Alaska, and that's current now. Okay, James, but there's a huge amount of sexually transmitted infections going on in Alaska per capita. They're the number one. You should know that for the exam, right? What state of the union has gotten the highest capita or the highest prevalence of a highest incidence of sexually transmitted infection? It's Alaska, right? And it's just amazing to me at what goes on in Alaska. Now I have 2 years ago, and when we were face to face, I had a young lady from Alaska, and she tells me I will want to weigh on that, right? She said the it's so interesting because there's a lot more men in Alaska than women, and so there's a calendar you guys can look. It's kind of funny. So there's a calendar that they print in Alaska every year, and it's entitled "The Odds Are Good, but the Goods Are Odd," right? So that she said that's from a women's perspective, and women publish this magazine. What they do is they have like pinups of these really kind of good-looking dudes. Because if you are a good-looking dude in Alaska, you have a good chance of getting a woman. If you're a woman, you have a fantastic chance of picking up a male because there's a whole bunch of them. But she said, but a lot of them are just not dateable. She said, and the reason that she moved to Texas was because she couldn't find an acceptable and so yeah, so it's one of those things that we need to truly understand and appreciate, and it we just have to know that these things are true. Right now, she said, I had a hard time finding a date in Alaska, even though I'm a female, because I just thought these people who were asking me out were just too odd. So, but I got here, and my first 2 weeks in Austin, I got asked out by 5 different guys, and all of them to me were acceptable, right? So, it's pretty interesting to think about. The lower epidemiological chart shows the incidences of chlamydia and the age group, right? And so I don't have it out here um, toward the older population, but there's a spike up here, mostly because of Viagra. And you should know that. You should know that Viagra is leading to sexually transmitted infections in the elderly because, of course, it allows for men to perform again, right? But here you can see that kiddos are starting at 10 to 14. At 15 to 19, they become active, right? And to me, it's interesting that there are more females becoming active, right, than males. It's just interesting to me. So there looks to be, some males that are having a really great time and are for somehow or another influencing these females for whatever reason, right? It becomes more kind of equal when people get um, into their the time when they start to um, select a mate and become more family oriented, right, toward their late 20s, early 30s, and so you become that prevalence, that incidence of chlamydia becomes normalized, right? And so to me, that was really interesting. I don't have the answer to why that is, but I mean, when I look at this data, I'm like, why is that, you know? And so we should question everything. Here's a healthy cervix, and here's one that's infected with chlamydia. And so you can see the problems associated with that. Okay. Okay. Other facts, right? So if we have this that is passed from mama to baby, there can be eye infections, pneumonia, and blindness, right? If left untreated, it can lead to scarring of the fallopian tubes and infertility. But also for the prostate and the vase for men, so that it doesn't mean that men don't become infertile, right? And having chlamydia puts someone at higher risk for contracting HIV, and it's estimated that 1 in every 15 sexual active females by age 14 to 19 have had an infection of chlamydia, right? So you know these are things that we need to think about, right? So we move away from discharge to talking about infections of the urogenital system that produce ulcers. And so we're going to be looking at syphilis, chancroid, and genital herpes here, right? Syphilis is probably the one you've heard of, right? And it's interesting, and you need to know this about syphilis for the exam. It has 3 distinct stages. It has a primary, secondary, and tertiary state, right? And it's typically transmitted through sex. However, in the second and tertiary states, when we have these open lesions, then the serous sanguineous fluids in these open lesions will have the syphilis cells in them, and they can be transmitted that way also, right? And I'll show you some examples of that, right? They can be real easy to diagnose, not only by symptomology, but also through a fluorescent antibody test. They're pretty easy to do, right? And so if a male sees this on their penis, I'm going to guarantee you they're going to go get it checked out, right? Because they care a lot about that part of the body, right? I think I told you about my roommate, who I think I told you about him. Well, he knocked on the door every Saturday morning. There was something wrong with him. He knocked on my door Saturday morning. I just finished work. I had gotten off work about 5 o'clock in the morning, stocking groceries. I was sleeping, and he knocked on the door. I said, "Dude, what's going on?" He goes, "I need to show you something." I'm like, "Oh no." So he comes in, he shows me his penis. He said, "Do you think this is an ingrown hair?" I said, "There are 3 of them." I said, "You don't have 3 ingrown hairs. There's something else going on here. You need to go get it checked out." Right. Well, he had herpes, but it's an amazing thing, right? Because he thought he had syphilis. First, he thought he had ingrown hair, and then he thought he had syphilis, and so it can be problematic. And so these are things, right? Primary syphilis, you have an ulcer that shows up, right? We call a canker, chancre. It's really chancre, right? Canker sores. That word canker has now become widely used. Has now become widely used as um, as just an ulcer, right? So you have to be careful when people tell you they have a canker sore, right? Because that, to me, that means different, right? So, but you just have to be aware, right? So this is not normal, right? If you have these lesions on your sex organs, it's just not normal, right? And so you need to go get it checked out. Um, yeah, it is. Yeah. Here's secondary syphilis. Secondary syphilis, it moves into systemically, right? Remember, we talked about how infections can affect the skin, right? We said that there can be direct entry. We said there can be an infection in the body, and then the symptomology shows up on the surface of skin. Is one of the rash that's associated with secondary syphilis. But it has gotten into the lymph system. It's gotten into the nervous system. It becomes neuropathic. The hair starts to fall out of your body, right? your joints, your liver, your eyes, your brain can be affected, and then that leads to tertiary syphilis. And in tertiary syphilis, you start to have these open lesions or these lesions, right? So you have this open, they're called guma, right? Guma means plural, gumata singular. But now you have these problems. And at this point, you can get treatment, but it's going to be hard to cure at this point. It's gotten so bad. And we don't get this bad in the United States because, we are pretty, we are pretty uh, observant to our bodies, and when we see something that's not correct, we're going to go get it checked out pretty quickly, right? But this could be 20 years in progression, right? And then all of a sudden you start to see those open lesions, right? You might have had recurrent episodes of having this rash over your body, but you just thought it was hives of some sort, and people don't get checked out, and then you start to have these guma, right? It can be hugely devastating, and at this point, you can die from having this bacteremic infection of syphilis, right? Questions. All right. Also, if baby contracts it in utero, there can be lots of problems, right? So you can have these Hutchinson teeth, which the teeth become bifurcated. I don't know if you can see. There's like a little peak here and a little peak here, right? You can have Sabertines or Cushing's or Clutton's joints, right? Painful. You can have this saddle nose, this what we call this saddle nose deformity on the nose, right? And you can have this rash that's on the child itself, right? And so these are all because of syphilis, right? They've inhibited, syphilis has inhibited some of the developmental periods of the tissues of the body, which leads to these problems, right? So it can be problematic. Questions? Cancroid is the etiology is Haemophilus ducreyi, right? I think that's the way you spell it. I have its name coming up in just a little bit, but it does mimic syphilis, and so you have to get it checked out and figure out that it's not really a spirochete, but it's a little gram-negative rod, and then if you figure that out, then you can treat it very easily, right? And so if there's going to be any questions of cancroid, it's going to be what's the etiology associated with cancroid, right? Cancroid means it resembles a canker sore, right? So then it's going to be Haemophilus ducreyi. Genital herpes is another one we talked about before when we talked about viruses, but I just want to make mention again that remember with herpes, it's not just an infection of the buccal cavity or the urogenital area. It can cause huge negative outcomes in the developing fetus um, in the mother's womb, and so we just have to understand that this is hugely problematic, right? And so it's people should really respect um, the fact that they got this virus in their body and seek treatment. Acyclovir is still the drug of choice, as far as I know, and it's an effective means to really kind of um, keep herpes, from just getting out of control, right? So I did spell Haemophilus ducreyi correctly, so there it is. But these are the these are the urogenital infectious agents that cause ulcers are the ones I'm going to talk about. The last group um, are the infectious agents that cause warts or wart-like processes. And human papillomavirus is an important infectious agent. Not only does it cause venereal warts, right, but it can lead to cancer, right? And so I was watching the Olympics the other day, which is kind of interesting, but exciting still. And there was a commercial for the vaccine for um, there was a sorry there for there was an advertisement for a vaccine, Gardasil, right? And so for human papillomavirus, and they did a real good job of explaining the relative risk of having HPV. And so they showed young girl and a young boy, and they were talking about cancers, the different types of cancers. And they did a really good job of conveying the fact that vaccines are to protect them, not only at this young age, but also as they become adults, right? And so remember, to me, um, having venereal warts is a nuisance and can be really kind of discouraging from people wanting to have sex with you, right? You're not going to touch them. But to me, it's the cancer that comes later in life from the dysplastic or displaced or the mutations that occur because of HPV that really can be detrimental to somebody's life. And so if we can save one person from developing um, cervical cancer, anal cancer, or mouth cancer, to me, it's well worth it, right? Another virus that is associated with the pox family is molluscum contagiosum. Molluscum contagiosum is a viral process, right? But it's self-limiting. Sometimes you get this once and never again. Sometimes you get this infrequently throughout your entire life because the virus can become lysogenic. Right? But it's not a problem other than it's scary when you see somebody's face that has this stuff on it, right? And these pustules, if you were to pop them, the inside of them feels real grainy, right? That's one of the things we can use to help them help us figure out what's going on. So again, this can form on any part of the body, right? But sometimes we'll see it down in the genital area. It's not, there's not much we can do for it, right? It's self-limiting. It goes away. Sometimes it comes back over infrequently in your life, right? Um, but um, but what I'm more worried about is if the young kiddos scratch it, and then the lesions become infected by another infectious agent like a bacterium or whatever, then you have a secondary infection. You get into those lesions, and then that can become problematic. Just by coming in contact with other people, Barbara, doesn't really have to be through sex. It can just be just kind of hugging each other, kissing each other, whatever, right? So yeah, but again, Barbara, it's not one to really worry about. It's just one of the, I mean, how many people have heard of it before today? Molluscum contagiosum. How many people have heard of it? Anybody heard of that before? Okay, so if you haven't heard about it before, then it's out there. Oh, you have. Okay, so where from what perspective are you talking about, Barbara? Where do you are you at work? Are you saying at work? Oh, gee, okay, okay, yeah. So yeah, but so you're gonna have a special insight because you're working um, at a guy clinic, right? But do they do obstetrics there too, or just gynecology? Both. Okay. So yeah, you're gonna have a special insight. A lot of people aren't gonna have that, but for the most part, most people have never heard of it, right? And so it's out there. You'll see it in your practice, but to me, it's not really one that I worry about. I mean, I've had two of my family members, young kiddos, who've had it, and um, both times they went, they just got reassurance from the physician that it's not a problem. How about in your practice, Barbara? Do your physicians give any kind of treatment for it? Do they give any kind of antiviral for it? Depending on. Oh, okay, 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 um, okay. So, what is the antiviral? Do you know? Yeah. Okay. Oh, okay. Okay. Yeah. New kid on the block, right? So yeah. Okay. Any questions? All right. So human papillomavirus and molluscum contagiosum, a little bit more information. I need to just talk about HIV/AIDS again. I know we covered it a lot in virology, but just it's important because we're seeing an increase in AIDS cases again. Really, we're seeing an increase in all sexually transmitted infections, but we're seeing an increase in AIDS patients or HIV patients again, right? So just remember, people don't die of HIV, they die of some other opportunistic disease. So here you can see are a lot of different opportunistic diseases, right? So if I ask a question, what is the number one outcome with people who die because of an AIDS patient? You need to say because of opportunistic disease. That's what really causes their demise. Okay. If we look at this is published in 2018 out of a paper that I read, and so if you look at the new cases of HIV, you can see that our Black colleagues are seeing, and our Latinos, right, are seeing a lot of them. But so those are all, and then white, you can see those are all kind of male to male. Now, when you think about that, right, the sex act itself is can break a lot of the capillary, and so if you're having anal sex, a male to male, then you can break capillaries and you have HIV. It can get in that way also, right? But then you can see that our Black um, heterosexuals and our Hispanic heterosexuals are kind of the new group that we're seeing cases in. And I was a little bit taken aback at the number of cases that we're seeing for those individuals, right? And so we just need to understand that these are a problem. And PrEP, as you know, PrEP is not making it easier for us who are trying to educate the population about being safe when you practice sex, because HIV and AIDS is an infectious agent that you never have to acquire at all. All you have to do is mitigate risk, right? And so if you see something that doesn't look right, Netflix, as James said, Netflix without a chill, right? So if we look at the different regions or states in the United States that are seeing the highest increases, right? So it's the District of Columbia, Georgia, Florida, Louisiana, Nevada, Mississippi, Maryland, interesting, Texas, South Carolina, North Carolina. So all of these kind of flow with the epidemiological map that I showed you of chlamydia a little bit ago, except Alaska's not on here. And Maryland is on here, right? So it's a little bit interesting that we see those distinctions on here. And that's the way I would like you all to at some point be able to look at a set of data, and when you're comparing it, think about what you're comparing it to, right? Not, this won't be on the exam, but as you get in further into your discipline and your practice, you're gonna see a lot of data. And what is that data telling you, right? Um, well, it's gonna tell you a whole bunch of different things of how you should be looking at this stuff, right? So you can be at risk of HIV if you have sex without a condom, receive unsafe blood transfusion, right? Are exposed to contaminated injecting equipment needles. 75%, a lot of the cases that we see of new cases of HIV are in sub-Saharan Africa. But outside of that, sex workers, men who have sex with other men, people who use injection drugs, a opioid problem, right? Transgender folks and prisoners have the highest incidence of HIV and AIDS, right? And so every minute, um, the ages of a girl between the ages of 15 and 24 gets infected with HIV in sub-Saharan Africa, and 1 million people on an annual basis die of HIV because they didn't know they had it, and the disease progressed and has become AIDS, and they were so far in the progression of the disease that their T4 helpers were wiped out, and then they died, right? So it's a problem, right? I do want to give a shout out to this lady, Ruth Coker Burks, who and I think it was Arkansas. Yeah, Arkansas, that's right. So when the AIDS epidemic first started, nobody would help these patients. So she had a piece of property, and what she did was she donated that piece of property for people who lost loved ones to AIDS, and including friends, because a lot of times family members would completely ostracize their family members if they had AIDS or HIV. but they could come and bury their loved one in the cemetery for free, right? And so I want to give a shout out to her because there's always really cool people out there who maybe just want to do something good for people, and so she did something really great, and I just want to give a shout out to her because the one image that I have was, most of you are too young to know this, but there was a young boy named Ryan White who nobody he had AIDS, but he got it through a transfusion or some other a teratogenic process, and nobody wanted to be his friend. Nobody wanted to hang out with him. Michael Jackson, say what you will about Michael Jackson, right? But Michael Jackson um, scheduled a trip to go and say hello to him and give him a hug in front of anybody who wanted to take a picture of it. And that's where that, I don't know if you remember that little post of it said, um, "Hello, I have HIV. Please hug me," right? Because it was so powerful that you had this superstar, right? Michael Jackson was in his prime, um, and he took the time to go out and visit this young boy and give him a hug and spend time with him when nobody else would, right? And so another shout out to Michael Jackson. By the way, a look at the history to figure out whether or not he was really what they said he was. He wasn't, right? He was a good person who was confused about a lot of things, but he was never what they depicted him to be in court, right? Yeah. One of the last organisms we'll talk about before we end this lecture today, and that's good because I'm running a little bit behind schedule, is group B streptococcus, right? Group B streptococcus is going to be found in about 10 to 40% of women. It's normal microbiota, Streptococcus agalacti. We want to be sure that through a good neonate screen for mamas to be, that we screen for this and we can treat it so that when um, infants are born and they're coming out of birth canal, that they're not going to pick this infectious agent up, because it can lead to bacteremia, meningitis, or pneumonia, which can all be life-threatening to an infant in their early days of life, right? And so a lot of times the colonization can be transient. With women, they don't know they have it. There's no symptoms, but it can be transmitted to the baby as they're coming out of the birth canal. Okay. In Texas, you might know that a lot of different school districts do not like to talk about sex, and so they would really like to talk about abstinence. And so there's a school, um, and I don't remember the name of oh, there it is, Crane High School in West Texas. They had over 300 students with an outbreak of chlamydia, right? Um, and so the school board had a big meeting about what they were going to do about it. And I think they decided to continue with their program about um, making sure people knew that abstinence was the way to go, but they were going to talk about safe sex, right? So maybe there was a little bit good that came through this really big outbreak. And then in 2019, there was an outbreak of herpes in Coachella and in Stagecoach. And so a lot of people came up with that. Now, it wasn't simplex 2, it was simplex 1. But remember, herpes is a lysogenic virus, so it goes dormant, and then you are out there. Yeah, there's a lot of sex that goes on at these festivals for sure. But most of it was simplex 1, and most of it was because people were stressed out because they were in the sun all day, and that's a stressor for people. And then so a lot, I don't know, there were thousands of cases of herpes that the media reported was being transmitted at Coachella. Maybe it was, but maybe people just had it already, and they were showing symptoms of it because of the stressor of being in that hot sun for that period of time, as Coachella and Stagecoach were in that time. I just thought it was interesting that in 2019, both Stagecoach and Coachella had an outbreak of herpes. I think it's pretty interesting to think about. Here is that map I was talking about, right? So natural part of the life of many people, including young people, right? So you can see that by age 15, 22% of kiddos have already experienced some form of um, had some kind of sexual experience, right? By the time they get to 18 or so, right? Um, about 65%, right? So if you're not talking to your young kiddos about sex, they're learning about it from somebody else. So this was data from 2013, and I think it's still pretty relevant. We're seeing an increase in all sexually transmitted infections, right? Even syphilis, there's a little uptick, right? Even though that's pretty rare, but there is a little uptick of the infections. Safe sex is important, right? And so, ladies, the men are irresponsible. Just know that. Um, now, I'm not being I'm not being completely derogatory to all the guys out there. As a whole, men are just not very responsible, right? So they're willing to engage, but a lot of times they're not prepared. So, ladies, you all need to be prepared for yourself, right? There's lots of different ways you can protect yourself. Um, if you want to have sex with somebody, right? There's female condoms, but there's male condoms, and females can carry male condoms around and say, no glove, no love, and then you can be protected when you have sex, right? So become very knowledgeable about your body, and really, if somebody asks you a question, especially if they're younger, teach them about being sexually responsible, because if you don't, then they're just going to make mistakes, right? No clowning around with multiple partners, right? And remember, Provi says that if you're about to engage, but the situation does not look good, smells bad, looks bad, Netflix without a chill. All right. Ladies and gentlemen, are there any questions about anything we covered today?